Care Policy Committee, 30th of June 25. I think the screen will display the agenda and reports behind us, even though because we're not in the council chamber, but the agenda at least is there, so we'll see how it goes.
Hello, my name's Bronwyn Falconer. I'm the Policy Committee Officer supporting the Adult Social Care Policy Committee.
Hi there, I'm Councillor Kaz Self. I'm substituting for Councillor Goggin today.
Hi, I'm Tim White, Councillor in Ashley Ward.
Hi, I'm Councillor Martin, Councillor for Froome Vale.
Hi, I'm Councillor Mohammed Makawi, Councillor for Cotton Wharf.
Councillor Andrew Varney, substituting for Councillor Joss Clark today.
Councillor Mark Weston, Councillor for Henbury and Brentry Ward.
Hi, I'm Shanice Abrahams and I'm here on work experience with Mark.
Good afternoon, Pete Franklin, Strategic Intelligence and Performance Advisor within the Resources Directorate.
Good afternoon, I'm Jamie Mahood, I'm Head of Service, Adult Social Care.
Val Samples, member Bell, but as of today, I'm an independent, disabled person on the meeting needs group.
Hi everyone, I'm Alex Johnston, I'm representing Wessel and part of the meeting needs group.
I'm John Marks from Vrils PA.
Hello, I'm Susie Giullari, Policy Engagement Leader, Care Support. I'm here to represent Bay Cares, been a member of the meeting needs group.
Hi everyone, I'm Megan Belcher, I'm Director at Bristol Disability Equality Forum and I'm a member of the meeting needs group.
Hi, I'm Mark Williams, member of Brill, and I'm Claire, his PA.
Hi, I'm Mary Jacobson, I'm Director for Adult Social Care. I should probably also declare that I was also a member of the Meeting Needs Working Group.
Kelvin Blake, Councillor for Hillfields Ward, Vice Chair of Adult Social Care, and I was a member of the Meeting Needs Group also.
There we are.
Oh, yeah.
Hugh Evans, Exec Director, Adults and Communities.
Lorraine Francis, Chair of Adult Social Care. Okay, so thank you all, everybody, for introducing yourselves. I'm just going to quickly outline the emergency evacuation processes. So we're not expecting an alarm today. So if we did have an alarm, we will make our way out of the two doors and along the corridor to the front and over through the cathedral. Obviously, you will just follow each other as we walk out. We will take a short break in an hour. And I would like to say as well, because it is quite warm, please do let us know if it's unbearably warm. And we will try and, you can have the only fan and we can just melt in the corner. Oh, gosh, yes. I didn't see that one. Okay, so but just do let us have a temperature check. Okay, so agenda item 2 is apologies, etc. So we've received apologies from a new councillor on the committee, which is Councillor Goggins, with Councillor South, as she's introduced, attending as a substitute, and Councillor Clark, Councillor Varney is so substituting, our previous Lord Mayor. Lovely to see you. And also we have apologies from Councillor Galasconi, okay, who's unwell, and we had no opportunity to get a sub. Okay, agenda item 3. Can I ask committee members if anybody has any declarations of interest that we need to be aware of for the record? Okay. we will make a record of that. Item number 4, I'm whizzing through. We just need to move the minutes of the previous meeting. So does any member have any comments about the minutes from our meeting in May, 12th of May? Okay. So we will, so we'll just assume that the minutes are correct as on record. And can I ask for a seconder, please? Councillor Blake, thank you very much. Right. Okay, fabulous. Okay, so let's move swiftly on to agenda item number 5, which is Chair's announcements. I guess there's a couple of, I'm going to make another comment when I introduce our item number 7, but just for short term. I just want to mention that we had a work programme setting workshop which gives members, so elected members, the opportunity to feed into our programme of discussion. So members can bring items and suggest that officers need to delve a bit deeper into a specific issue, and then it could ultimately come to committee. So I would like to thank the members who attended on the 24th of June this year. Councillors Clark, Macawi, myself, and was that it, I think? Yeah, I think that was everybody. So thank you very much. It was actually very, very productive, and we all managed to, I think, get something out of it. We did have apologies from Councillor Martin. Yeah. Oh, yes, and Councillor Weston, because I did see you. Sorry. Yeah, no problem.
Chair, can I just double check there's no public forum today? Is that correct? Lovely, thank you.
Thank you, Councillor. I'm looking at my agenda and I'm still missing it. Okay, so we have... Yeah, I'm just getting there because I was... so I do my chair's announcement and then we would have public forum. So that's kind of my main thing because the workshop is incredibly important. Okay, so agenda item 6 is public forum, and we have no public forum statements or questions. So, but we do have members of the public here today, which is fantastic. So when we got onto the meeting needs group. So,
I just wanted to make a point about the workshop. I mean, obviously it's during the working day, and I just wonder whether or not perhaps in the future we could look at maybe varying it so it could be done maybe in sort of the early evening to give the opportunity for other members to attend. You know, I just, it's difficult to kind of balance off everyone's responsibilities outside of obviously council duties, and I know it's an important one. I know we submitted some ideas. We had a sort of process in the Labour Party where we looked at all the various committees and we submitted ideas through to each of them. Yeah, I just wonder whether or not, just for future reference, if we could look at maybe varying it to try and increase the likely turnout for it. I know there's no simple answer with this, but you know, I just wonder whether that's worthwhile looking at.
For the record, with respect, Councillor Blake, and I respect your comments, the Greens were present and Lib Dems were present, and whoever wasn't present, Councillor Weston sent his apologies. And because it's a long process, it was about three hours. It would be incredibly tough to sort of start maybe at 5 or 6 when people finish work if they're working full time, and then go on into the evening. And I think it's a process that's actually been going on since the previous administration and the previous administration before that. And I think that would be quite a challenging request to actually fulfill. And whilst we're on the subject, I understand that there is going to be changes coming from central Labour government that will impact on the committee, so maybe it will change as a result of that. So let us move on, because that is a by the by. There was a date, it was well documented. I think it was even in the previous minutes that the work programme setting was coming. Okay, so let's move on. So, agenda item, sorry, I'm changing glasses, I'm putting on the wrong glasses. Agenda item 7 is annual business report, which Bronwyn will just briefly outline. So this report is the arrangements for Adult Social Care Policy Committee as agreed at full council on the 13th of May this year. So there's no decision, and I will invite members, if you have any comments about this particular item, once Bronwyn has concluded her summary, then please do feel to ask any questions.
Hello, good afternoon, everyone. I'm expecting this to be quite a brief item, as Councillor Francis has said. This is a short technical paper confirming the arrangements that have been agreed at full council excuse me, in May, which contain the terms of reference, membership, and future dates for this group. So this shouldn't be new information. The only change to the previous terms of reference and arrangements that should be noticed is membership, as Councillor Goggins will be replacing Councillor Johnson. That's the main change, and everyone should have all the information already. So yes, welcome to have any comments or questions to clarify, but otherwise I'm happy treating this as a short technical piece to note that we have noted.
Any questions, anyone? Any observations? Fabulous. Thank you. Thought through that because, thank you, Bronwyn, because we want to get to one of the two main items for today. So I am really pleased that the working group report is being presented today. This is a report produced by a Meeting Needs Working Group, who are welcome to committee. There are no decisions to be made, as this report is for information. The Bristol City Council response to the recommendations will be subject of a future report to the Policy Committee. So members are asked to focus any questions you may have on the report itself as presented today, to avoid preempting any future works. So, you know, you can ask any specific comments about what did that mean or something like that, but please do not make any kind of recommendations or suggested recommendations during today's discussion, because that would be really unfair to all parties involved. So, much to my delight, I would like to invite Alan Davies to introduce and outline the report. However, before we do that, I would ask members from my right of the Meeting Needs Group to introduce yourselves, please, and then when we get to Alan, he's good to go. So we'll start with Mark. Thank you.
Mark Williams from Brill, and a participant within the Meeting Needs Group.
Yep, so I'm Megan Boucher, from Bristol Disability Equality Forum, so member of the Meeting Needs Group.
Susie Giuliari, Care Support, Bristol South Gloss, member of Meeting Needs Group.
Alex Johnston from Wessel.
Val Samfield of Brill, but independent lived experience member.
And Alan Davis, independent chair of the Meeting Needs Group. Thank you, Chair, for your introduction. I'm delighted to be here today to present the report of the Meeting Needs Group. There are actually 9 members of the Meeting Needs Group present, because yourself, Councillor Y, Meta and Councillor Blake were also members of the group for reasons that I will explain in a moment. There are about 5 or 6 members of the group not present, but this report comes to you with unanimous support of all of the members of the group who attended the meeting to sign the report off, and that includes all of those members who are present today. All unanimously supported the report. So I'd like to briefly introduce the report and give the members background and explain what we did, how we did it, and what we've come up with. Members will remember back in 2003, the Adult Social Care Department produced a draft policy called Fair and Affordable Care, That policy created some discussion amongst some disabled people, both locally and nationally, who expressed concerns over some aspects of that policy during the consultation period. At the end of the consultation period in January 2004, the then exec member withdrew the report. The exec member also wrote to me in my role as chair of the Bristol Disability Equality Commission, asking me to set up a stakeholder group, just slightly to take issue with the wording of the report. It wasn't a co-production group as such, it was a stakeholder group, or task and finish group, to look at a particular topic. The Disability Equality Commission decided that I should undertake that role as an independent chair, which is what I did. So what was the task we were given? The debate over the fair and affordable care policy highlighted the key issues that are around. That is, how do adult social care departments, all 158 of them in the country, how do they meet the ever-growing demand for need with an ever-diminishing budget in a very confusing legislative framework? That's at the heart of these issues and at the heart of things that you as committee deal with probably every time you meet and every time you sit and think about these issues. Undoubtedly, adult social care is in crisis. In my humble opinion, that crisis is due to, as I said, the funding issues and the legislative confusions. So Councillor Holland gave me the very easy task of setting up a group to explore how adult social care could provide its services to people who want them in a fair and equitable way within a financial and legislative constraints and framework. So, as you can imagine, that task took us about 3 minutes, and we came up with a very easy solution. Sadly, no. Because what the debate also showed around the fair and affordable care policies, there are lots of differing views about how that conundrum can be addressed. There are lots of differing agendas. Not just if the issue of the lack of financial resources, and just to be fair, to show my complete political impartiality, those resources to adult social care from central government have differed whatever the colour of government. Red, green, blue, purple, pink, black, sky blue, red, sky blue, pink. All of the national government has, how can I put this, not seemed to prioritise funding for adult social care, shall we say, putting it as mildly as I can. So not only that issue, but the legislative issue is just as important here, because there are a number of acts that impact on this area. There's the Health and Social Care Act 2012, there's the Equality and Human Rights Act. There are a number of acts, and as wide as a number of acts, there are a number of lawyers with different views on them. You could get 3 lawyers all looking at the same clause in any of those acts, and they'll all give 3 completely different opinions, and they'll say that those opinions are what they believe. And obviously, different groups, different individuals will look to different lawyers and solicitors to give them different advice. And that advice may well be contradictory, but everybody will say that's the advice because I have a lawyer who says it. And that makes life very complicated. So this group came into a very complicated situation and absolutely did not set out to come up with the solution and their answer, because it is not possible. Personally, I believe that if a government, whatever government, had a different priorities in terms of funding, that could be significant, but that may not happen for a few years at least. So we were left in a situation of having to deal with that. And as the chair, it came to me to how to work out doing that. And the first thing that I realised was the membership of the group had to reflect all the different views around the table, from those who want a radical solution to those who believe the City Council can cope the best way it can, and everything in the middle. So in choosing the membership of the group, I was very clear to reflect that broad range. And obviously not just to reflect disabled people's issues, because although this primarily impacts on disabled people, it has much impacts on carers, it has much impacts on older people and people from BME community. So the membership of the group that you will see in one of the appendix of the report was as broad range as it could possibly be, with a range of experience and views. The other thing it occurred to me is that the group needed to get expert advice. So I'm actually quite a fan of the select committee model of Parliament, which is probably not a popular thing to say, because I'm also a fan of Parliament, which is probably also not popular, but and councils, of course, having been a councillor many years ago. I believe in a democratic process, and I believe that the Select Committee works in the way that it brings together witnesses and experts on that issue, so that members of Parliament can listen and consider. So it seemed to me that that would be the most appropriate way to run this group. So all of those issues were concerned in the terms of reference. And as I said, the task was to look at a fair and equitable way within the frameworks. So basically, the group met between April last year and May this year. There were 10 meetings in total. I asked the members of the group to propose witnesses, and all of their proposals were accepted. We had an initial list of about 24, 25 witnesses. About 16, 17 witnesses attended, and those witnesses, again, were from a broad range. There were activists there, individual activists and organisational activists. There were those who had a particular agenda. There were academics, there were service providers, there were individuals. So there were, again, the list of witnesses is an appendix in the report. So there were a range of witnesses, and each witness was given 15 minutes to make a presentation, and then members of the group could ask questions. And what came out of that, in many ways, didn't surprise us as the group, that the issue is very complex, the issue is very complicated, and while some people may have some clear opinions about how it may be resolved, when those opinions are tested against other facts and circumstances, there is no easy solutions. I think what also surprised some members, and probably surprised me, was the level and extent of services an adult social care department provides, the budgets involved, and the decisions involved in the decision-making process. So understanding the full extent of what an adult social care department has to do, I think, was interesting. Particularly to me. So at the end of the process, the group considered all of the evidence that came in, and their considerations are in the appendix marked reflections, which is a basically complete list of everything people submitted after the process to me about what they thought. And we then went to basically look at what recommendations we could come up with, because I'd been given the group had been given the task of coming up with recommendations that yourselves as Adult Social Care Policy Committee could consider, with the absolute understanding there were no promises as to how you would react. There was no commitment. I was simply given the task of producing a report with recommendations, and then for your consideration, which obviously, as Councillor Francis explains, you will be doing at a future meeting. You will be considering your actual response to the recommendations. There are 13 recommendations in the report, as you would expect. None of them are the quote silver bullet. There are no easy answers in there. What I would say is that I think the group has done a remarkable job of identifying some key questions and key issues. I'm not going to single out any of the recommendations in particular, because that would seem that I was highlighting some more than others. But if you take it as a package, they consider the whole issue of service delivery, of eligibility, of process, of how you as a local authority navigate the issues with your other partners, and how you navigate the world of the wider politics, convincing other authorities to recognise the importance of adult social care. So for me, I knew there was going to be no easy answer. What I hoped the group would produce was something serious, well considered, thought through, and potentially effective. Personally, I believe that's what we've delivered. I can speak no higher than that I think the group have given you a product that has taken a long time, has taken challenging. There have been moments in the group when my chairing skills were called on, shall we say, to navigate some of the different points of view, but we got there, and I think you've got something there that is serious. As far as I'm aware, no other local authority in the country has done this kind of piece of work. So once again, Bristol is leading the way in terms of the way that you consider issues. So I think you've got something there that could well be a model that other local authorities want to address. I'd like to close with some thank yous, obviously. First of all, to Councillor Holland and to Councillor Francis. They both showed remarkable political courage. Councillor Holland in setting the group up in the first place, and Councillor Francis in carrying it on, even though it wasn't her political group's decision and the administration changed. And Councillor Holland set it up without knowing what the... So to both Councillor Francis and Councillor Holland, I think they deserve thanks for their political courage and for their determination to carry out a difficult task, because neither of them knew what the group would come up with. Obviously, a thank you to all the witnesses who attended. They all gave up their time voluntarily. They all were very serious and considered and produced professional and thought-through contributions, through which the group could not have done its work. Most importantly, though, it's a thank you to the members of the group, not just the 5 who are here today, but all of those who attended over the process. As I said, when I selected the members of the group, I wanted a wide range of people. I didn't quite know how it would go. It could have been very combative and very challenging and very confrontational. And I think it's a credit to every single member of the group that it did not happen like that. In some of the feedback at the end of the group, members expressed a view that had been their fear at the beginning, and they were pleasantly relieved that it wasn't. And I think that is all due to the seriousness and the professionalism and the thoughtfulness that every single member of the group showed to their work and commitment to their work. None of them were paid to do what they did, and they gave up, together with reading time, probably the best part of 50 hours over a year's process to produce this work. So I couldn't have done this work without them. This report is not my product, it's their product, and because it's what they've done. So, Chair, I'm very proud to present the report to you and to the committee, and I'm very happy to take any questions that members may have.
Thank you very much, Alan. Thank you for the great overview, and I think all members probably fully understand the process now. So I would like to invite both members of the meeting group itself, if you wanted to add anything to what Alan said, and members, if you have any questions that you want to ask of the group. So I'm going to start on my right. Any visitors have any specific observations, and then I will go over to Councillor Weston with the first question. Mark, do you want to say something?
No, Mark's all right.
I think just to reaffirm the thanks and the appreciation for the whole meeting needs group, and for the fact that it was even happening, because it was quite a tricky process, and I think Alan navigated well through it, and I think it was just a real testament to all of us kind of seeing the bigger picture and wanting to come together to get something together that might work, and represented all of our views in there.
Thank you.
Oh, is it me? Yeah. Yes, again, I second what Megan has said, but I also like to add that it was a very constructive learning journey, I think, for all of us. I think I speak for everybody. We reflected on that. There's a number of reflections that we put in the report in addition to recommendations, because I think there was a real development in understanding and coming closer together in terms of voluntary sector representatives, people with lived experience, and the council, and understanding how much pressure everybody's under, how difficult the situation is, how unprecedented the crisis is. And I think in my experience, it is helping us working with commissioners, is helping. So I think it's a great process to do, not just for the recommendations themselves, but actually what we've all learned and improving our working relationship from different sectors.
Thank you, Susie. And Alex.
Yeah, just echo what Alan and everybody else has said. I think my question is to council officers and politicians, how will the recommendations be treated? What process will they go through so we can understand as a group the impact of that work?
Oh, sorry. I forgot to turn this on. So what I'm going to do, I'm going to default to Meta, and she's going to answer that question. Yes.
Fantastic. Yes, so as I said in my introduction, I was also a member of the Meeting Needs Group, so I think I just wanted to recognise that I'm speaking now with my council officer hat on, not as a member of the Meeting Needs Group. So we will have, I think first of all, I think to say is that officers have received the report with sincerity and taking it very seriously. I think that's really important to say. Within the Meeting Needs Group, now I'm going to swap over and put my other hat on. You know, we did have a discussion about what will be the value of this work. Will anybody be listening? Can we trust the council to take it seriously? So I'm just representing that worry from the group. So this is an exercise in trust building as well, that the fact that this has been received with good intention. So we have a process mapped out internally, which in fact we're starting tomorrow, which is for a group of us to begin to come together to have a look at the recommendations. We've agreed in the very work programme setting meeting that Councillor Francis referred to earlier to then come together with members of the committee to go through together the kind of responses that we might be proposing to the various recommendations, so that members of the committee can have input and help shape the response that we will be making. And then I believe scheduled, at least in pencil, if not in ink, Bronwen, we intend to return in the October committee, probably, with a final report, which will be the response to the recommendations. And I guess I would just add, if it's October, why so long? Partly because it actually takes us quite a long time to go through the decision process to get ready for committee. And so we need a lead-in period of a couple of months by the time we've actually finished writing the report. So that's what's planned at the moment, unless anybody wants to add to that.
No, that is perfect. I've got Councillor West and Councillor Watt. Any further comments about the process, and then we'll switch over. Okay, Mark.
I can work out how to turn this on. Yes, I think we should offer that. It's a very, very fair and very reasonable thing, and I think that it would be reasonable for you to see. We deliberately haven't done any deliberating on this until after today, because it's only fair that the report should be presented by the people that pulled it together, and we start afresh beyond that. So likewise, I think it would only be fair for us to give you an opportunity to see the outcome of the deliberations prior to the October, I think, committee, where and I think that in the spirit of this whole business, you know, the way that it's all been about collaboration and about us supporting each other and everybody's voice being of equal weight, I think that's a fair thing to say, Meta, yeah?
Yes, I agree, and I think it's a very good observation, Mark. Thank you for that. So we'll need to think about how we build that into the programme of work that we had and that we have. And I think it's probably fair to say then it will definitely be October, because to build in another step, which is a fair step, I think we will need the time. So thank you for that.
I will deal with it, Mark, as chair.
Yes. So because sorry.
All I was going to say was that, and I'll apologise in advance for our processes, but seriously, it does take about 6 weeks in between something being finalised and the actual committee, maybe even a little bit longer, just simply because of the round the houses way that it has to go. So Yes, Alan can coordinate if you're happy. Yeah, that's right, Alan.
Yes.
So,
Yes,
but we anticipate that if we want to get in for the October one, then we really are looking at having had it all done by the end of August. So it seems like a long time, but as soon as you get into the council bureaucracy, time shrinks or expand. No, it shrinks.
And not only that, it's going to be summer holidays and so on and so forth. So I think the outcome, and then I'm going to questions, is after the meeting tomorrow, we will probably be better placed to have a schedule with some dates sort of planned in, and then we will just take it step by step. I think we've less of the actual meeting needs group consultation or discussion has been we took it step by step, and Alan didn't get to point Z before we'd got to point A. So it's really important that nothing's been the wonderful thing about committee is that we are engaging openly, transparently with you all, and we will not hide anything. I am not going to allow us to suddenly backtrack on that. So be rest assured, you may not get, and I don't mean Mark, royal you may not get the outcome you would necessarily all want or wish for, but we will be open and transparent. So that's what we can guarantee. Okay. All right. Fabulous. Right. Mark, followed. Okay.
Yeah, it wasn't
Okay.
it wasn't really a question, it was an addition to what Meta said. One of the other things that we agreed as a group is that some of these are quite easy, like asking for more money from the settlement for social care, reasonably easy. Some of the other things, like the campaign for real care, need some legal and financial checking, and the direct payments obviously needs thinking out about what the invest to save kind of model is there. So I think we all agreed that some of these things would take a little bit of tweaking out, didn't we? So to come back with a proper and thought out and reasoned response to them. So that's another reason for the time. Sorry, I'll shut up.
I mean, I as Alan had done, I was hoping that we're not going to get into the detail of the appendices. We're just not going there. So anything that comes out of an individual's mouth is coming from that individual, as opposed to rest of the process. So please, members, questions about the processes, etc., as opposed to the detail in the appendices, because that's really important that we don't preempt any outcomes. Thank you. Councillor Weston.
Thank you very much, Chair. No, just on the process going forward, it would have seemed to me for the agenda setting conference for these meetings, the report would be ready for then, broadly speaking. So that's probably looking at September. It would have occurred to me that would be probably, if possible, a good time to release, to get, because I think it takes time for you to pull everyone together. So even if it's a case of there's a grand public response to it at that meeting, but that would seem to be probably the earliest we can get it. And I'm just going to make that point. I just wanted to check. So obviously we've got the recommendations in front of us. Are we allowed to ask why they making that recommendation, or are we not allowed to get into that weeds? Because I do have one recommendation. I do want to ask the rationale behind it.
If you are clarifying something,
yes,
that's okay, as opposed to going into detail about it, a discussion about it, sorry.
I'm even happy to get this if it's easier offline to share, but for me, the recommendation number 10, which was adult social care should spend less resources in providing information signposting, I just wanted to understand the rationale behind that, because some of the problems I've had trying to support disabled residents in my ward is that if you know the system and you know where to go, then it's logical to cut signposting because you know where it's going. But actually, if you're relatively new coming into it, signposting is essential. So I'd just quite like to know a little bit of why there's that recommendation, so I understand that.
I'm happy to offer clarification, Chair.
So Susie, I believe, as well.
Do you want me to go first, Susie?
I don't mind.
So, essentially, Councillor Weston, that recommendation is around the authority making some choices around its resources. There is a growing level of, what's the word I'm thinking of? there's a growing feeling out there amongst groups who work with people who use services that perhaps the balance isn't quite right between the amount of resources that goes into information services and the amount of resources that goes into direct service provision. There's a growing concern out there that there may be now an imbalance, and that because of the ever-diminishing resources underpinning service delivery, there is a feeling out there, not universally shared, but a feeling that is getting stronger, that perhaps in times of really crisis-level resources, there should be some reconsideration of priorities of resources, and perhaps some of the resources that are currently dedicated to information advice could be redirected to direct service delivery. So that's essentially the background to that recommendation, if that helps.
Okay. Thank you, Chair.
Thank
Can I
you.
just add to that? I mean, that recommendation is based on ample evidence, national evidence, that this is a case.
Thank you. Thank you. Okay, Councillor Martin, thank you.
Thank you, Chair, and yeah, thank you to everyone on the Meeting Needs group. It's really interesting to read this report and see recommendations from such a wide range of expertise and experience, as a councillor especially. I was going to ask about one recommendation and one reflection, but Councillor Weston's already asked my question about the recommendation, so that's very thankful. That's fine. The reflection was about, it's reflection number 4. So I'll just read it quickly. It's the messaging around adult social care that there is a focus on prevention is misleading and not an accurate depiction for those going through their care journey. Honesty, accountability and transparency as values need to be embedded to allow for people going through the care journey to feel accurately informed. So I'd just like some clarification about that. If it's to do with saying that we care about prevention when actually we're not being honest because the resources aren't there. Maybe you could just say a bit more about that, please.
Happy to do that, Chair, if you'd like me to. Thank you, Councillor. I think it's part of what you just said. It is part of that people, sadly, and I am not singling out this local authority, but in many local authorities, when budgets get tighter, it's often preventative services that perhaps feel the first brunt of the reduction. So I think there is some concern out there about how serious local authorities are towards preventive services. And also I think there's some concern out there that because the level of funding for direct services is so low, is preventive services being seen as, quotes, an easier way out, close quotes. And I think the third thing is a wider point around, I think there is still some concern out there amongst organisations working with people who receive care and support services that the journey is not clear still for many people. The information they get from statutory services may not be as totally clear as it could be. And there is still perhaps, even in today, even in 2025, there is still perhaps among some people out there a lack of understanding of where to go. I know members may find that difficult with everything on the web and everything else, but I think we have to remember that the vast majority of people who use adult social care probably aren't as digitally informed as many of us around this table. There are lots of issues, whether accessibility, whether poverty, whether language, whether culture, that means that a lot of the people who need to use adult social care services do not access that through digital services. Their preference is either telephone or good old-fashioned paper. And so therefore, there's a feeling out there that some people don't know about what the services are, and when they get into the system, the options open to them may not be delivered as clearly. Now, of course, I'm highlighting here issues that people raise. The vast majority of people who go through the vast majority of your services have an effective journey of it. Your satisfaction rates on your service user levels are high. Your annual, I've forgotten the name of this annual survey now, Hugh will remind me, but certainly when the last time I looked at it, they're very high percentage. So the quality of service most people using your services receive is incredibly high. You generally produce very high quality services. Obviously, though, the issues and concerns will be those that are reflected. So I think around that prevention one, is the local authority serious about prevention? And is the journey that many of the people who undergo the services, or some of the people, is it as clear to them as it could be? Does that help?
Yeah, thank you.
Thank you, Alan. Okay, so Councillor Blake, and then Becky. Oh, did you have a question, Mark? Oh, Councillor Blake, Becky.
Okay, thanks. Well, thank you for the work you've done. It's really important work, and navigating what is quite tough and difficult times for people to receive exactly the sort of care and support they need on an ongoing basis. It actually meets their needs, but also is kind of cost effective for councils to deliver as well. And that's the conundrum we're trying to achieve here. And personally, I think that there's a lot we can do together to help close the gap. But until it's resolved nationally, we will always have a big challenge locally fixing the system. Now, there is obviously the government have announced the review of for a care service, right, taking place. I would like it to happen a bit quicker than the government's announced. But nevertheless, there's a trying to build cross-party consensus around the provision for a care service that actually is sustainable and funded correctly, ongoing, without it being a political football between the parties, right? Which has happened in the past. That really needs to come into effect alongside the work we do locally, right? If we're ever going to actually solve this issue properly. So I think what I'm saying is I think we need to do as much as we can locally and listen to our colleagues and our stakeholders seriously. Keep independent living at the central core of what we do, and making sure that is a sort of forefront. For me, that's kind of what this sums up. All the recommendations, as far as I'm concerned, add up to, trying to provide the best solutions and services to let people live independent, disabled people live independently as much as possible. And that's kind of, for me, what this amounts to. And we need to do our best to meet the recommendations with a serious action plan to implement it, but bearing in mind it's within a broken system, and that system needs fixing, and that is only going to be fixed by a cross-party parliamentary solution that's not going to be wrapped up in a political football that kind of then that doesn't ever get dealt with. I'm hoping this time we will get to 29. It's too far away, but we'll get to 29 when this report comes out, and we can agree. We can encourage our own parties to kind of agree on a way forward to finally resolve this issue, and people can live independent lives, disabled or not disabled, moving forward.
I am going to say this. I stressed it really clearly that we're not going to preempt any outcomes, and I think that it is really important that we keep an open. That we don't get into monologues and determining outcomes, because I think that was a little bit kind of making a statement about potential outcomes, and we need to stick to the premise that we are going to discuss this, we are going to be open and transparent, we are not going to hide any decision making. That's really important. Becky. And we've got about 6 minutes left of the debate. Thank you.
Was that me?
Discussion. Yeah, over to you. Sorry, Becky.
Megan.
Sorry, why am I calling you Becky?
That's okay. It was actually just to come back on the point around prevention, just to add to what Alan was saying. But I think it was about the gap between what the messaging is and what people are actually experiencing, and just maybe kind of bearing in mind a bit more that the intention might be there, but that's not conveyed to the people who are actually like going through the process. And if there's a more kind of honest account of where the system is, if it's not about prevention, that could be kind of more helpful and lead to kind of less distress, I guess, for a lot of people. So that was, I think, part to add to what Alan was saying.
Thank you. Okay, does Councillor Barney and then Val.
I will ask a quick question. I'm not sure if it's allowed though.
That's
but
right, I'll tell you if it
you
is
can
then.
tell me if it isn't
I will.
allowed. Okay, so are we planning at this stage that we take the recommendations as a whole and take those forward? Or do we think there's some scope to maybe doing a bit of pick and mix and saying, well, this recommendation we can take forward, this one we can't, and would that still be considered to be a success?
I think that's a really good question, Councillor. We will be discussing all the recommendations, and we will then have the opportunity to discuss it with members, and then we will be discussing it with the meeting needs group. So there is not going to be but that's what's going to happen. So we will be discussing it, and I think that's the only thing I can really comment. Good question, though, I understand the rationale for the question as well.
Chair,
Okay.
if I can just contribute to the chair of the group.
Yeah.
I think the meeting group members are very realistic and are very politically savvy. So they would expect you to consider all the recommendations, and then they would expect you to produce the proposals you produce. Some of them may be what members like, some of them may not be. So I think members are very realistic about what you can achieve. Certainly as the chair, I am very realistic about what you may or may not support, but also not what you may decide to vary, or you may decide to come up with a longer timescale, perhaps, than the group would have liked. So I'm expecting a variety of responses from yourselves, because that's the reality of the political process. And then when the recommendations come to committee, I'm expecting a variety of responses from members, because different members will respond different ways to different recommendations. So I anticipate the discussion in October being a lively and clear and fascinating discussion, of which I will be very happy to sit on the sidelines and watch it take place.
Okay, so I'm going to ask Val, and Meta will have the last word unless anybody else, any of our meeting these group members, have got any further comments. So Val, then Meta, and we're done. Thank you.
My comment is to go with Anne and Megan. The care journey is a very long one. From the council point of view, from the person seeking that care, is very frustrating. And when you look at the recommendations, that is something you need to bear in mind.
Thank you, Val. Meta?
Yes, I was just going to add, following Mark's good suggestion, that as we work through the possible response to the report, I think it would be valuable for also to look for more opportunities to co-produce answers, because it may be, as I think Councillor White pointed out, there will be some questions that will require more work and may not be worked up by October, but might present opportunities for further co-production. So I just want us to hold that spirit in mind, really, because I think there's been real power in the process, and I have shared with colleagues my experience as a council officer of probably the closest I can describe it as is power sharing as the only officer on the group. These were difficult conversations sometimes, and we navigated through it with respect and for each other's experience. So I think in our response we should look for other opportunities for co-production if they present themselves.
And just to reflect, Chair, and to remind the committee, you do now have a co-production process. As I said, I was very clear this was not actually a co-production group, because that would have been something different. this was a way of working together and exploring things honestly and openly. You do now have a formal co-production process that you agreed at your meeting in October. So as Meta said, you could consider using that process to implement some of the recommendations in the report.
And I'm going to have the final word, which is to I think I've said this several times today just to annoy everyone further. So we will be showing due diligence going through this process, and we will ensure that we are transparent, open, realistic, all the rest of it, all the things that we've said today, so that even if members of the meeting needs group find that they don't get everything they want, if anything at all, it won't be because we're fudging. We will be open, transparent, and do what we need to do to make sure this process is credible. Okay? Because if it's not credible, you will tell us. So that's what we're aiming for. So I'd like to just finally say thank you all. First of all, Chair, for chairing the group and being very, very good at chairing the meeting needs group. Thank you for the members of the meeting needs group, and especially for coming today on a very hot day. So thank you for coming and spending your time with us. And we look forward to seeing you in the future. Thank you very much. Oh, sorry, we're going to have a 5 minutes, maximum 10 minutes break. So if you'd like to use this opportunity to have a break, thanks.
Councillor Martin.
Oh, no. Back. So we're going to continue with the agenda. So we're on agenda item number 9, which is the CQC Assurance Outcome Report. This report is to provide details of quality inspection of adult social care inspection report, which was published on the 30th of May 2025. There are no decisions to be made. This report is for information. I did want to just add the CQC inspection was carried out by an independent group to assess the effectiveness of Bristol City Council adult social care in delivering their services. The importance of scrutiny cannot be, and as I felt that the CQC listened to the officers, members, and those accessing the service. So I think this has probably been the first review that's been had by the local authority for a while. 10 years? More than 10 years. So it's the first, and I'm sure that Hugh, I'm going to hand over to Hugh, and he will hand over to Meta. Thank you.
Thank you, Chair. I will hand pretty directly over to Meta, but thank you very much for that, and thank you, Chair, and other members and also colleagues for the support and effort you put into the process, both prior to the on-site inspection and then during the on-site inspection, because quite a number of people in this room really had quite a lot of put quite a lot of effort to contribute to it. It has, the process all in all took about a year, maybe just shy of a year. The CQC is at its kind of outset in regard to working out how to do adult social care inspections. As Councillor Francis said, prior to this, the inspection of adult social services stopped in about 2009, 2010. So we really haven't had anything like this for way over a decade. And so for us, it was a major process of preparation and of continuous improvement building up to it. I'm sure Meta will tell you a bit more about some of that. But for the CQC, it was as well. And I think that we were very lucky to have a professional and capable inspection team who actually came and did a really neat and tidy job for us, and also were in communication with us prior to and subsequent to the event. So all in all, other councils I know have had a much more difficult time with it, and I think ours was not easy. It was challenging, but it was still, I think, a positive experience, and I think Meta will bear that out as well. So I'll hand over, and I still haven't said anything about the outcome. Meta can do that.
Thank you, Hugh. So yes, for the record, I'm Meda Jacobsen. I'm the Director for Adult Social Care, responsible for our care management and in-house provider services. And it's my pleasure to share with you the outcome of the CQC assurance process. As Hugh has mentioned, the assessment process took place over about 9 months, from June 24 to January 25, and our report was formally published by the CQC on the 30th of May. During that time of the assessment, we had various stages of assurance. The first was to submit what was a very sizable information return, it's called, which was hundreds of documents, which the CQC has then pored over. During the autumn, we met with the CQC inspection team in what was called a leadership presentation. So the whole of our leadership team, a very formidable group of people, shared with CQC all about how adult social care works in Bristol. And then in January of this year, we then had a 4-day on-site visit by the inspection team where they met with a range of stakeholders, both our colleagues and a number of external stakeholders, partner organisations, the NHS providers, people and families who draw on care and support. We are delighted that our score came out as 64%, and you will see in the report that that amounts to a rating of good. So the CQC still uses one-word ratings. I know there's been a lot written in the press in relation to other inspection regimes, but for the CQC, they still use the one-word rating, which of course should not distract attention from the many pages of the report. So good is the summary, but by no means the substance. You'll see from the report that that's 2% into the good range, so it does mean that that's the lower end of good, and we receive the report with pride, but also with a degree of humility, because our improvement work continues, of course. There are a number of highlighted strengths and good practice examples included in the report, and of course much more detail in the full CQC report. We were thrilled that people said they had positive experience of their assessment process, that people felt that it was person-centred. We were particularly heartened by the fact that the CQC highlighted that we had a good understanding, a good grip on how we support people with risk through their care journeys. And that we had a good process for learning from serious events. So that means that when the unspeakable happens, that we then have a good way of structuring our learning around that and supporting our practitioners to understand what happens. They particularly highlighted our relationships with partners. I think in our previous item, you've had a good example of one of those pieces of work, but there were many pieces of work that they highlighted in respect of how we engage with our partners and with our disabled and older community, which we were very pleased with. The area of waiting times is one that we will have heard about in this committee before. They had good evidence of our degree of processing, or our degree of progress in that. And they were particularly impressed with our data environment, so the degree to which we were able to draw accurate data to understand our own improvement journey on that. And we were able to, during the actual inspection on-site week, we were able to give them data and show them how it had changed from when we sent them data back in June last year. So we were able to give them a really clear overview of our progress. There are, of course, areas for improvement. There always are, where our work is never done. And certainly, having concluded the on-site visit in January and having received the report during April going into May, already many things have changed in that time. But they particularly drew out waiting times. As I've just said, we've made huge amounts of progress, and more progress even since this report was written. But we're never done. And we'll hear from Pete here later as well in terms of some of that work. Some of our partners felt that we needed to communicate better in relation to the safeguarding loop, as I call it. So when somebody refers in for safeguarding, making sure that we come back and tell them what happened at the end of it, where we're able to do that and where we have permission to share information. They highlighted the need to record better demographic information about people, so making sure that equity of experience is at the top of our priority list so that we can provide an equitable service. That means we need to make sure that we ask more courageously about people's demographic information, their sexuality, their faith, and so on. And we found that we don't have sufficient records about that. So that's, again, work in progress. We work all the time on housing solutions for people with additional needs. We've reported that here before. And a really high priority for me is to continue to look after our colleagues and to make sure that we've got good career development for them. The improvements that the CQC highlighted were no surprise to us, I'm thrilled to say. So they are already in our continuous improvement plan, and the work is underway on that. Overall, we consider the report to be a fair representation of the state of affairs in adult social care. I think that's really important. As Hugh said earlier, there are authorities who've also both not had a good experience, but also have felt that when they received their report that it wasn't a true reflection. We feel that it's a fair reflection, and we've had the opportunity to comment, and I think that's really important. I would particularly like to thank our colleagues and our partners who contributed not only to the assurance process, but also to the work that we do every day, that actually we don't do anything in isolation, we do everything together. And I want to particularly highlight our colleagues, our front-facing workers and our social workers and our teams who were queuing at the door to tell the inspectors about the good work that they do when they came to visit. So we were thrilled with that. And I commend the report to the committee. Thank you.
Thank you, Meta. Okay, so this is the opportunity for questions. So I have Councillor Blake, Councillor Barney, Councillor Martin, Councillor Weston, I'm going to have to write that down now, and then Councillor Self. Okay, thank you.
So yeah, I mean, I think, well, I'll just echo everything you said, Meta, in terms of the report kind of fits about right in terms of where we're at as an organisation. And I think that, you know, in getting here, there's been quite a number of changes that have taken place, going back actually, you know, a couple of years in terms of making sure we got on top of the data, for instance, to then be able to understand where we needed to focus our attention. And I think you've been a big part of that process, which I think have helped no end. I think still we need to be focused obviously on those weighting and getting those numbers down, and we'll see later on we've got that focus as well, and ensuring that we kind of check in on people that have waited a while to ensure that their sort of needs haven't increased or not, or indeed lowered. So I think that's a sort of our focus. But I also wanted to raise the issue of our peer challenge report that was done prior to CQC came in. We had a review that I think, could you give us a few words about how helpful that was in terms of preparing us for the CQC report? Because I think that is part of a process, this, and I think that helped us, didn't it, get us in a position where we could respond better to the CQC and better focus our resources going forward.
Leave it to you, I'll just chair the people.
Okay, thank you. So yes, certainly, I think it was a quite a powerful tool for propulsion for us, if I can put it in no better way than that. I had not been here that long when we undertook the LGA peer review. Hugh and I were both very keen that we should have that as one of our preparatory tools to have a really good look at ourselves, and we did that from a standing start, so without any preparation really. You know, we didn't rush to prepare for them in the way that you might have done for an inspector, because we wanted the, you know, the true and honest picture, and that's certainly what we got. It had a series of recommendations for improvement, many of which we had started but had not yet borne fruit. And so, if anything, I think the LGA review gave us two things. It gave us confidence that our improvement journey was facing the right direction, that we were doing the right things, but it also gave us energy and focus to continue that work with real energy and passion behind it.
Thank you. Councillor Barney.
Thank you, Chair. Thank you, Meta. I just wanted to understand a bit more about the waiting times for carers' assessments. Is it purely a matter of HR, or are there other issues at play? And I'm also pleased to note that it is moving in the right direction as well.
So the short answer is that it's a good number of different things that go into that. You have a report later on the agenda today on the target operating model, and I'm sure that Jamie will probably want to pick up some of the complexities around this. So if I was to pick some of the top things that go into it, so yes, definitely workforce. Our workforce had become very seriously depleted. And when your workforce is very seriously depleted, you put out fires. You don't work strategically and in a measured way to do that. I think the second thing, as Councillor Blake has highlighted, was data. So certainly when I arrived in Bristol, we didn't have a rich data environment, and so I could not easily lay my hands on how many people are waiting, how long have they been waiting for, what are they waiting for, and what are the points where they're waiting. I couldn't do that. I could do that now at the push of a button. So, and I look every day. I can tell you that today we've got 350 people waiting for an assessment, and they've been waiting on average 55 days. So that's the kind of data-rich environment that I have now. And then I think the third thing, which is the bit about the target operating model that you hear about in a moment, is about the fact that we have a system that's just too complicated to operate. And every now and again, you need to have a look at it, because it's you've arranged it in a certain way, and then you've added something, and then you've added something else, and before you know it, it's time to have another look about whether that's working. One of the things I thought was significant that Val said to us earlier is that the experience of people is that the journey is really long. And one of the things that we highlighted is that people might come to the front door, for want of a better word, and wait there, then they might wait somewhere else, and then they might wait somewhere else, and then they might have their assessment. So the target operating model, I'm stealing your thunder here, Jamie, but so we've had a really good look at whether or not we can simplify that journey for people so that we have less wait points, and therefore we shorten the journey and we don't repeat work, so we become more effective. Does that make sense? Those were the top things I think I would say in answer to that.
Okay, who's going to jump in?
Just very briefly, just to kind of doubly get the point across, some local authorities have done well in their CQC inspections and had quite a lot of people waiting, whereas others have done away with all of their waiting lists. You know, you can always chuck some additional, agency staff or what have you at it and not done so well. And I think the very points Meta makes are absolutely key, which is the CQC needs to be confident that you've got systems in place that ensure that if people are waiting, they're waiting well, which I think we can demonstrate much more readily now than ever before. Also that, if you do have a positive, well, in our case, a negative positive trajectory, as in fewer people and waiting for less time, that it's not going to creep up again, that you're going to stay on top of it. And I think it's being convinced of that gets you a good CQC outcome. So I think that's what I think was most pleasing about this, and evidence of the success of the improvement journey. The fact we got it and we've sustained it, and the 3 or 4 months after, it's still being sustained.
Okay, Councillor Martin.
Thank you, Chair. Well done to everyone at the council for this. This is good. It's good that we got good. I've got a few things. One is about how I felt this report, it drew my attention a lot to unpaid carers and the contribution they make to society. And I met with Carers Trust this morning, who said it's like 35 to 40 million, which the NHS saves because of unpaid carers. So that just shows a huge contribution, and it's good to see things like direct payments seem to be improving. I feel like that's what the CQC found. And that, there's still so much work that needs to be done, and so many people who need to be identified as carers, people who don't even know that they're carers, and I'm kind of interested, to know if we have a sense of how many people or what proportion of carers are kind of unknown to us. But maybe I can ask that a different. I don't know if you have a quick answer now before I move on, or I can find out later.
Not in a number, no.
Okay, that's right.
It'd be interesting to have a wider conversation about carers, but certainly, when I say that the CQC's findings and the way that they've written report is fair, carers is definitely an area that we ourselves worry about. I chair Bristol Carers Voice, which is a gathering of carers organisations and carers with lived expertise. And so we have regular communication about the experiences of carers in Bristol. We know that as part of our target operating model and the way that we support carers, that we have work to do in making that a more accessible process. You will also be aware that the all-age carer strategy was recently published, and the Carer Centre and Bristol Carers Voice will be helping to co-produce the action plan that goes with that. So there's real carer voice within that. We've recently had a project called the Accelerating Reform Fund, some additional funding that we got from government, and part of that has been about identifying and supporting carers, including carers who may not have been known to us previously. So it's one of those pieces of work that's never done, because we need to continue to identify.
Thanks. And the other couple of points about, we've said about there were some things were expected, the things we needed to improve on, and waiting times has come up a lot. But something I spotted, which I hadn't really seen before, was they said there were risks about deprivation of liberty safeguards, which I feel like hasn't come up that much in these meetings. And that's obviously for people with basically people with dementia, isn't it? Which is the group I work with. So could you say a bit more about that?
Go ahead. I've got a view, but
No, I mean, I would either or.
Okay, I'll stay. So, deprivation of liberty safeguards, or DOLS for short. So if you hear us as officers saying DOLS, or people around the country saying DOLS, that's what we're referring to. Which is, by way of explanation, is a legal methodology for approving, for us as an authority to approve depriving somebody of their liberty. So somebody who doesn't have capacity to make decisions, who needs care perhaps around the clock for their own protection, that amounts to a deprivation of liberty under the law, and that has to be authorised and reviewed regularly, so that we both listen to people in terms of their choices, but also that we ensure that the system keeps people safe. We're in the middle of, and we have been for, I don't know actually how many years now, 3 years, maybe more, we've been thrust into a sort of strange period where there's been a proposed change in the law, or a proposed change in the regulations, which has added additional workload to local authorities in this area. It used to refer to disabled people and older people in residential care settings. Now it's also in the community. And so exponentially our workload has grown. That means that the waiting times for doing the assessment and the assurance and the decision making around deprivation of liberty had grown and had gone beyond our resources. So there is an improvement programme around that. We've got it registered as a corporate risk because we wanted our corporate team to understand what we were doing around this work. And we have a way of, as we do with all of our waiting times, the waiting well principle, which is that we're checking in with people while they're waiting, and we're prioritising those which fall under what we call, I think it's section 21A, which is if there's somebody who's objecting, even the person, even if they don't have capacity to make decisions, if they appear to be objecting through their behaviour or some other clues that we're getting, or a family member or an advocate is objecting to that deprivation, we will of course prioritise those, and many of those end up with the court of protection.
Yeah, I mean, nothing much to add. It's just as I understand it, the community DOLS element, which is, beyond the residential nursing establishments, it was introduced in 2014, I think, but then since the early 2020s was the liberty protection safeguards. The previous government promised that there'd be a revamp of the legislation, but it became mired, as so many things did, in the technicalities. And I think the proposals were going to create, well, we thought by the initial workings that we did in 2021 that it was going to require an additional 38 social work staff for us for Bristol to be able to undertake what was then proposed under the liberty protection safeguards. multiply that across the whole country, and obviously you've got a problem. Well, you've got a problem even just for 38 in Bristol. So it is a bit of a conundrum, but Meta's right. Since the introduction of the community element of it, the demand on councils for dolls has become way more than the vast majority of councils can fulfil. And so it's a national problem, and there's national recognition of it.
Was it your last question?
Last question was just about it, more vague actually, but I kind of noticed a recurring theme of issue of communication between partners, basically in the council, as being something to improve. Yeah, I know that's kind of vague, but you might know what I'm talking about. Yeah, I don't know.
Yes, I do think that we did demonstrate quite strong, partnership work, both within the authority and also between us and partners more broadly. There's always things that we can do to improve that, but I think we demonstrated quite strong partnership, especially when it comes to the development of things like a corporate, the all-age carers strategy that was in the process of being developed, ready for publication at the time of the inspection, our corporate safeguarding approach, which is extremely positive and has really, started to get a lot of people in other areas of the council that wouldn't ordinarily think of themselves as primary safeguarding leads to actually think about what their implications of safeguarding is for people, let's say, who are working in street scene, or people that are working in parks, or people that are working in libraries, or what have you. So that was very positive. And of course we've done a lot of excellent work in regard to housing as well. So I think, again, I'd have to refresh my memory on that particular recommendation, but I feel like we gave pretty good evidence of being very joined up and partnership orientated. And you'll see in our gradings, the partnership and communities element, we do get a green and a good within that. So I think we're on the right track with all of that.
Okay, so thank you for your questions, Councillor Martin. We've got a few more minutes, and I think that, so we've got Councillor Weston, and then we've got Councillor Self. So,
thank you, Chair. I'm happy for some of this to come back in writing after, well, I'll just put it now. First of all, you can't take away from the good work. Obviously, it's lovely when you get a green. So often we're used to being on the needs improvements. I don't want to detract from that at all. It does, though, just raise a couple of warnings, so pardon me for getting into that. Obviously, we've got 5 green dots, we've got 4 yellow dots, but the balance is in the right direction. But you do feel, I'd just like to know, and happy to take this away, what are we doing to improve the 2s? Because they're the ones that obviously need improvement, and I'd like to know a little bit about the systems we're going to put in place on that, and particularly the safeguarding one. And I've got to say, the safeguarding was a strange one, because the words that went with the score don't seem to reflect the score we got. We were above average in certain areas, and they still gave us a 2, not a 3. So it was surprising on that. I'm sure you couldn't possibly comment, but the comments were, you can, yeah, you're going to. Yeah, so it was a bit strange, but I would like to know, for my peace of mind and the scrutiny function that we're doing, how we're going to turn the 2s, how we're going to turn the frown upside down.
oh gosh.
Here to help, Chair, here to help.
Okay, so the brief answer is, I referenced earlier that we've got a continuous improvement plan. That's our internal working tool. It's our engine for how we collect up the areas that we're working on. I chair something called the Quality Assurance and Improvement Board for across adult social care operations. That's the place where I have oversight of all of our improvement plans. We do regular self-audits, and we have regular reporting on the data. I do that every month, and I have my service managers come and tell me about the work that they're doing. So we have really good mechanisms for oversight, if that makes sense. I think even Pete is present in our meetings. And one of the things that you will have also seen from the report is that CQC highlighted specifically how there is really good governance in place and oversight in relation to our statutory duties. Well, that mechanism is part of that highlighted oversight that they brought out in their report. So that means that we've got eyes on all of the time. And I shared with you some numbers earlier in terms of people waiting. I can tell you that because I have regular reporting and I know where we are and the data tells me so. And we track that all of the time. So that's how we know where we are. And of course that gets reported to Hugh's leadership team, and risks get escalated where we feel that there is mitigating actions that we need to take. In relation to safeguarding in particular, there are two elements probably that I would draw out, and you might want to add something to that. You will have seen from our previous discussions, but also from here, that we implemented the multi-agency safeguarding hub back in the autumn. When CQC came in January, you know, the paint was still drying, if I can use that expression. It was still quite fresh, and they were very complimentary about it. Partners were really complimentary about it. It was clear that we had all the right people around the table and that all the processes were set up, but we hadn't quite had enough time to prove that it was working, if that makes sense. Okay. We've now had more time to prove, and we've done some evaluation work to show that it's working and to continue to evolve the methodology. So some of the twos in the report is about the fact that the improvement journey was a bit too fresh for them to have full confidence that it was going to bed in. Does that make sense?
Yeah, okay.
Yeah, so that's what I would say about that.
All right, thank you.
Yeah, how to put this? Obviously, there are one or two areas where...
Recollections may vary, is probably...
Well, yes, yeah.
I'm not going there.
No, but there were one or two areas where I'm convinced... well, I mean, what Meta just said, really, if they came now, I think that we'd be up to threes with some of them. I think that's fair. I think we did think equity and experience and outcomes, especially one of the lead officers was saying we was robbed. And I'm not going to say that officially in the meeting, but at the end of it, there were one or... Yeah, I know. Absolutely. Wouldn't that be bad? But no, there were one or two areas where I'm sure we were pretty borderline, you know. And so I think that what we've got is, you know, we've got a low good, but I think there's every chance if we carry on with the trajectory that Meta and Jamie and colleagues and Tom and others have put in place, I'm pretty sure it's unlikely we'll get re-inspected very quickly, because I imagine that the programme of follow-up will be for the ones that RI, you know, requires improvement. So the chances are there may be focused inspections like you get in children's on particular areas, maybe areas where we're RI. But I'd like to think we'll be boosting it up next time, well into the goods. I'd like to think we could even be outstanding.
And I guess we can, you know, request as committee that we get data, you know, in a year's time, so in January, that we have some real feedback on this as well. So Councillor Self, and then I think that's it, because we're a little bit over time. Did you have a question, Councillor Y? Can it wait? No? Okay. Thank you, sir. Councillor Self.
Yes, I was going to ask 3 questions, but my second question was on the same point as Councillor Weston, so thank you, Mark, for asking that one. In particular, I was going to ask about the number 2 on safeguarding, you know, and it mentioned shortfalls. I kind of want some reassurance that the shortfalls aren't anything that we should be worried about. Maybe you can get back to that when you get back to committee later on. You can bring that reassurance. But in terms of coming to this committee as a fairly new member, it looks good. You know, I was going to ask in terms of how do we compare to other councils? You know, should we be pleased, or are we still towards the bottom in terms of other councils? And my other point was going to be in terms of continuous improvement. I was going to sort of mention things like SMART objectives, which I hope you're familiar with. You know, are some of our continuous improvements, for example, realistic? Are you bearing in mind these sort of measurements and so on, and the SMART acronym, which is specific, measurable, assignable, realistic, and time-related when you come up with continuous improvement. That goes for all the stuff you're doing later on in the report as well, by the way.
Yeah, I mean, very briefly, it's good to be in the good category. I think that there is a cluster of councils that's kind of around the top third of requires improvement and the bottom third of good, and we're in that cluster, which is good company to be in. There are very, very few outliers. There aren't any councils at the moment that are inadequate, and there's only one, which is Camden, Keir Starmer's constituency, and the Camden director is the new president of ADAS, which is the Association of Directors. So they had it all going for them. But Camden's the only outstanding one so far. Fair play. It was a brilliant report, Camden's report, and the director is a very good person, and I like her very much. So we're kind of middle of the road, but at the high end of the middle of the road. Not much more to add on that, really. I mean, but we know ourselves about our own scope for improvement, and that, for me, is the most important thing.
I think, for the record, I do want to provide you with assurance in relation to safeguarding. I'm just looking at the data now, and I can see that our speed of decision making and our speed of allocation is really healthy. So we have a good thing going, and we're doing further work to improve our processes, which Jamie might refer to under the target operating model report. But in terms of understanding our business and helping people to be safe, I do want to provide you with assurance.
Yeah, and I think one of the things about any kind of waiting list for safeguarding is the worry, because I was like, when I saw that we had a waiting list, so we shouldn't. So anything that's going to get us out of that situation is going to be vitally important. Councillor Y, do you have a brief question? You sure? Fabulous, thank you. So, right. So thank you all for that. There was a nice, healthy presentation and discussion. So this report is for noting. So what I'd like you to know is, 1, the completion of the Care Quality Commission inspection of adult social care and the publication of the inspection report. 2, the strengths and good practice highlighted in the report and the areas for improvement, and the arrangements to oversee and take action to address all areas for improvement. And 3, the positive contribution of people who draw on care and support, colleagues and partners to the inspection process. So I'd just like the committee to just note the report. So thank you very much. Okay, so we have 3 more items. I'm going to hold us to time. So we will move on to agenda item number 10, which is Adult Social Care Target Operation Model. This report is to update us on the Target Operation Model, project's purpose, progress, and how it supports the modernisation and continuous improvement of adult social care. So again, there's no decision to be taken on this report, which will also be for noting. So I will hand over to Hugh to introduce, and then he will hand over to Jamie. Thank you.
Thanks, Chair, very much for that. Yeah, I won't stand on much ceremony. This is a very, very important, probably one of the most important parts of our transformation and improvement journey. And I'll hand straight over to Jamie to give us the down.
Thank you, Hugh. Good afternoon, everyone. I'm Jamie Mahood. I'm Head of Service. I'm currently working on operational transformation. I've got the name right after 6 months. It's taken me long enough. I think the conversations we've been having with the Meeting Needs Group and about the CQC report, and I think even the LGA peer review that was mentioned earlier, really set the scene as to why we need to do what I'm going to talk about. We have seen a lot of improvement in terms of delivery around waiting times and our system, sort of the person's journey through adult care, but we've still got so much to do. We still need to improve those, and I think Val talked about the journey through adult care and how long it takes. Really, that message still holds true for a lot of citizens. So the sort of journey of this started back in 2023, where we had a strategic partner who did a diagnostic on adult care, and they found a lot of the shortcomings we've talked about it here earlier, that the system's can be difficult to manage for the person, from first phone call until a social worker comes in. People are often having to retell their story. Meta mentioned earlier about the people being passed from one waiting list to another, and actually also our workforce establishment at the time and still was insufficient to respond to the demands, and when you compare to comparator cities as well. So something about our operating structure isn't sufficient to meet the demands of the city. So what do we hope to achieve from the target operating model? I think it's probably worth clarifying that when we talk about the adult social care target operating model, we talk about sort of in common parlance care management or our social work and occupational therapies teams. This is not a redesign of our commissioners or our provider services. This is about our social workers and our OTs and our non-professionally registered social workers going out and seeing people and doing assessments. So that's what I mean as a shorthand. Ultimately, we want to design a service that supports the required outcomes for our citizens in line with our adult social care vision, and I'm hoping everyone in the room has sight of and knows of our ASC vision. It's about creating the right skills mix and operational sufficiency to make sure that we can respond to our statutory duties. And again, it's about driving forward a framework of good practice and a culture of continuous improvement. So, what does the target operating model mean and look like? You would have hopefully seen in the papers, there's a diagram with the vision in the middle and a number of bubbles around this. We like to call that our bubble diagram. And in essence, it forms 5 key pillars of work that we're working on. So this is not just about a restructure of services. This is, although that is critical to the delivery, but it's also around a people and change or a culture piece, about getting the right high-performing culture. It's about having a performance framework that really measures our effectiveness and efficiency. We've gone really far on data, but we've got more steps to go around how do we monitor that, how do we know we're achieving the right outcomes for our citizens. It's about the right skills and learning offer for our staff, and it's about our process work stream. So specifically, how do we address the people being passed from one place to the next to minimise that as much as possible, so that we can get it right the first time as much as possible, and we can make sure people aren't retelling their story over and over and over again, which we know unfortunately is a shortcoming of many adult social care deliveries. So what have we done so far? In terms of the adult social care structure, we've designed a new operating structure for our operating team, and the key changes we're looking at is a change to our what we call our front door, our initial assessments of people who are coming into adult care for the first time. So that's moving to a citywide service with more multidisciplinary face with an increased number of occupational therapists in there, and that's so that the people who make that first phone call or respond to that first referral is the person that goes out and does that assessment, so they're not handing on to another team. So we're trying to shorten the amount of handoffs, the amount of lag time between telling people's story again and again. So that's a sort of priority piece of work we're looking at. We've moved some of our specialist functions into our community team, so our kind of reviews activity, which I think we'll talk about waiting time. So our community teams are going to be focused on doing more planned reviews, so trying to move a little bit away from firefighting to more preparatory work, more planned work, which means we can get it right before things reach crisis point more often. There will always be crisis response, but it's about trying to focus more on our proactive approach to adult social care and planned reviews. We're making changes to our skill mix. So the change to adult social care operating will increase the number of caseholder posts within adult social care by about 10 FTE. We're making a significant change to our number of OTs. Currently we have 1 OT to every 10 social workers. That's at odds with most local authorities. OTs play a huge role in preventative interventions, equipment, getting the right outcome for people. So we'll be moving to about 1 OT to about 5 or 6 social workers. So that's quite a change. We're doing that by changing the number of social work establishment and reducing that slightly and increasing the number of OTs. And finally, the big key change, which I think we were talking about at the end of the last item, was around safeguarding. So we'll be moving to a more centrally held model of safeguarding coordination. So that means when safeguarding inquiries are undertaken, currently they sit with the individual teams, which means our safeguarding team don't have oversight of the practice and the decision making. And so it's led to, at times, it's led to a lack of consistency in practice and lack of oversight. A centrally held coordination model is held by a number of local authorities quite successfully, both in the local area and across the country. And we've had quite positive response from the teams in our consultation. So our engagement started on the new structure in November Obviously, I think we put a lot of investment in terms of bringing our staff with us, and I think in previous changes, we've not put that same investment in bringing people along and getting people to support. And through that engagement process, we have made adjustments to the proposals. We've made adjustments to how some of our skills mix would look, off the back of feedback from our staff and from our managers and from some of our partners. Obviously, the consultation was delayed slightly because the CQC were on us in early part of the year, and we went out in the beginning of May, and we closed that the beginning of this month. And we're currently we've collated our feedback, and we will be proceeding. Our aspiration is to deliver a new adult social care structure in September, and we're currently in the process of looking to appoint matched staff to the new roles within that organisation. In terms of feedback from the workforce, broadly, we have a supportive workforce. I've had lots of feedback from colleagues saying we're ready, we're on board with it. There is a degree of trepidation whenever you have these changes. It does cause some worry of where am I going to be working? Am I going to be, having to move office, etc. But broadly, our feedback is really positive. I think the fact I've had quite a few other staff going, we're ready, Jamie. We really want to get on and make this work. So I think that's been really positive. There have been some concerns about the change to the skills mix. I think when you say, we're going to have fewer social workers in the establishment, that causes some anxiety. But I would stress that's our establishment total. We still have a number of vacancies, so we won't see a reduction of the actual number of social workers we have on site. Whilst we've made good progress in recruitment, we still hold anywhere between 25 to 30 social work vacancies that are either filled with agency staff or held vacant. So we're not going to see a reduction in staff. No one's going to be, we're not talking about any redundancies at this point at all. Everyone will have a role in adult social care. So we are now in the process of what we're talking about, our process work streams, about reducing those handoffs, and that's being co-designed with our staff and our managers. And we're looking to deliver on the operations in structure in September, and then post-September, because I think previously when we delivered new structures, we put all our energy into delivering it, and then kind of the project team has walked away. We're embedding a review process until the end of year's end, so we'll be revising our processes and practice throughout that to make sure we've got it right. There will be something we have forgotten that we need to go and fix after we've adjusted it. We are only human. The other key part of why the project is running the entire year is about our performance framework, and I've met with our adult social care co-production advisory group, because we're really keen to co-produce some of our performance framework and some of our metrics, because we can create, Pete and I and Meta and Hugh can create lovely KPIs which we think are really meaningful, but is that meaningful for, the Vals and Marks and other people of this world? So that's really key for us as well. I think I've rattled on fairly quickly. Ultimately, we want that co-production framework in place because it'll help about our kind of aspirational vision, aspiration of delivering on our vision. I think I'm going to wrap up there, and happy to take questions. I might pass back to Meta if she has anything you want to add.
No, but now that you've given it to me, I will. Only that, in the context of the previous report, I look at it as a kind of short-term, medium-term and long-term horizon. This is the medium-term horizon. With preparing for CQC, we did lots of short-term preparations to be as healthy at that point as we could be. The target operating model is about changing how we work to put us on a secure footing going forward so that we can sustain the progress that we've been making. So I just wanted to make that point to connect the two, really.
Yeah, and I think, thanks, just give me so it's going to be Councillor Varney, Councillor Self, and then Councillor Y. Quick questions, please, in a moment. Not quick, but don't answer 20 in one go. I just wanted to say, it's going to be really, really important for us to be monitoring this as we go along, because I just, like you say, there's staff and then there's service users, and I think staff can often feel left behind. So I am very pleased to hear that there's going to be a continuation and review as you go along. Do you want to comment on that, and then it will be over to Councillor Varney.
Thank you, Jay. You just reminded me, we've some of the feedback we've had from a number of staff and workforce throughout this process is that the communications and engagement strategy is better than any other restructure they've ever had, because we've had support, a really good project team around ourselves, really good communication strategy. And I think you can't speak too much to the staff. I've met, I think people have got bored hearing my voice on Teams calls. I've went out to visit people. We visited teams. We've got a newsletter. All ways that we've tried to communicate. So I think we've done our level best to bring people, bring people with us.
Thank you. Okay, Councillor Varney, then followed by Councillor Self, who just chip in, okay, when you're ready.
Thank you, Chair. Thank you, Jamie, for that. Just regarding staff, is there going to be any training that's required for them to get used to the new processes, the new way of working? And also, just out of interest, which specific change do you think is going to bring the greatest improvement in efficiency?
Thank you, Councillor. So we have a learning development training plan as our core training offer, which everyone has signs up for where they join the local authority, and we have regular CPD on offers. We will be doing workshops around how our new model will be expected to work, and we will be doing workshops around performance, because I think we don't talk as much around expectations. So there will be training and workshops around that, and we will be trying to co-design some of our expectations processes. So none of the things we're doing should be a surprise. We should have our managers and seniors in the room whilst and that's happening right now as we speak. In terms of the most positive area, I would say the front door element. At the moment, we have 5 different teams doing slightly different things. So in order to get an OT assessment, for example, you'd have to go through one area, someone will look at it, then it will get passed here, then it will get passed there. So that will reduce that significantly, or if someone needs an initial assessment. So I think that offers a real opportunity to get it right first time. So I think our front door it offers the most important. It is also the biggest risk area, so we need to really get it right, because we are making quite big changes. So I think that's our most exciting area. Thank you, Councillor.
Thanks for your report. As a former engineer, I saw many improvement processes in my career, and I kind of welcome what you're doing here. I guess what I wanted to understand was what percentage of employees have kind of responded to any consultation. And you mentioned firefighting. That kind of raised a little bit of an alarm bell, because what I know from engineering is the more you do up front, the less firefighting you have to do downstream. So can you give me some kind of comment on that, please?
Thank you, Councillor. In terms of engagement, we've had, we have a workforce of somewhere in the operations around 300, establishment of about 370 in that operating area. We would regularly have engagement teams calls with in excess of 200 people engaging in the process. Not everyone would be feeding direct comments and commentary, but we had really good attendance at a number of those. We also ran specific engagements, looking at specific work groups. So whether that was our social workers or our OTs or our non-professionally registered staff, our social care practitioners. So we ran a number of different sessions in different ways. So we had really good engagement with staff, even at comparatively short notice. The firefighting analogy is one that's often used in adult social care, and I think it's usually akin to the number of people waiting for unplanned. Something's gone wrong, and we need to get there, today, tomorrow, yesterday. So that continues to be a challenge in some areas of our adult care service. We have put in extra resource in some of our front door teams in preparation for this change. So we've gone from having about 900 people waiting for initial care assessments, I think last December, I can't remember if memory serves, and now that's about 350. So we've got we've been doing our best to mitigate and reduce that. There will always be emergencies in adult social care, so we always have to design a certain amount of flex in our system for people on duty to respond to those. But we need, by doing more, it's a sort of simple analogy, but this sort of stitch-in-time approach, by doing more planned reviews, more planned work, we would hope that we would reduce that number of unplanned urgent work. That will always exist in adult social care, but we need to do our best to be a high-performing organisation to avoid that as much as possible.
Does that answer your question, Councillor? Thank you. Councillor White, I think you're the last question. Thank you.
Thank you. When I read this, I thought I was getting frustrated because of the lack of detail in the paper. That's really, really helpful. Just a couple more things. I would still find it quite helpful if it exists to have where are our full-time equivalents now, in which team, and where are they, and what's the future structure, and maybe just a kind of bit of a flow chart about person comes in, what happens to them now, and then what's the plan for the future. That would just help solidify it in my mind. And also that I lost a bit about whether we're spending less or more on these staff or not. So that'd be a good thing to touch on. And the final bit of that in that structure is there a change to the hospital discharge-based services?
I'll do my best to answer all those, Councillor. So the flow chart process, the process work stream is done a 2B flow chart. Some of them are quite small, some of them you would, if you printed them off, would cover the entirety of the wall. So that's why we need to make them smaller. I'm sure we can do best to show that. I mean, so the whole idea of the front door flow chart is to simplify that down, and we have seen from our initial 2B mapping sessions that to be a shorter process, Councillor. So hospitals is a short answer. We're not making any changes to that. We adopted a if it ain't broke approach to some of those areas. Some of our service areas are changing quite significantly. Others are working quite effectively, not without pressures, but we're not making any changes. The one change we're proposing, actually, I think is a very sensible one, is that we have a specialist standalone mental health hospital team, and that will fall under the same responsibility of that same head of service, that structure. So we're adopting a kind of common approach so they will, I forget the terminology, but it's about putting equal weight of importance on mental health as it is to physical health. So that's our one change, but other than that, you won't see any differences or changes to discharge to assess hospital discharge. Was there something else? Sorry, there was another question there. On our structure, there is no change. Our staffing envelope is remaining the same. We're using it slightly differently.
Just one very quick question from Councillor Self.
Yes, thank you, Chair. You mentioned city benefits, reduction in waiting times for the Care Act assessment. I was just interested if we have data, and I'm sure we do, on the minimum, average and maximum waiting times for an assessment. Yeah. Perhaps you can share it with us sometime so we can see whether those are moving year by year.
Yes, so in fact, perfect introduction to our next report probably. I think I mentioned earlier that today our average wait for a character assessment is 55 days, which means that there will be some people who are waiting longer than that, and there will be some people who are waiting a lot less than that. Jamie has described very well that we have a number of different entry points at the moment, and they do very different work. Some of them do slower relationship-based work. Other people working in the hospital discharge environment where speed is everything, so have smaller caseloads but do faster work. Other teams have bigger caseloads and slower work because people take a longer time to engage with. But the average is 55 days at the moment.
Thank you for your great questions. Okay, so I will just read out the recommendations in this report. So that the committee, point 1, notes the aims, objections, approach and status of the target operation model project. 2, notes the project is focused on enabling the delivery of the transformation and improvement programme and the MFTP savings of, 14.5 million across adult social care. That's what we have to try and reduce, which is not great. And 3, supports the ongoing delivery of the project. So to conclude, I'd just like to note that note the recommendations as pointed out. Okay, thank you. Yeah, I said it around the wrong way. Okay, so we are going to move very swiftly into the agenda item number 11, which is the quarterly performance report for quarter 24 to 25, isn't it? So we're not up to date with quarter 4. Well, it's up to date, but quarter 4. So again, no decisions. So I'd like to invite Peter Franklin to introduce himself and outline the report.
Thank you, Chair. Yes, I'm Pete Franklin. I'm the Strategic Intelligence Performance Advisor within Resources. So I'm independent of... Sorry, I'm not sure if you're
there we go.
Thank you, Councillor. I'm Pete Franklin. I'm independent of adult social care, so what I'm giving you is a unbiased report based on fact and numbers, which brings me back to Councillor Self's earlier question around the longest wait time. I don't have that to hand, unfortunately, Meta, but I can find it out for you. And I can also give you a list of all local authorities that have undergone a CQC inspection and the ranking within there as well. So I'll send that to you as well. What I'm presenting today is Q4 24-25, which is as at the 31st of March 25. It's the most up-to-date information we have in relation to our progress against those measures and metrics that were contained within the corporate plan 24-25. I'm going to be a little bit cheeky, Chair, and at the end kind of touch on 25-26, if I may. So what we've got is a situation where I've listed all of the actions and measures of success, the metrics that come under the remit of this committee. You'll see on page, next one, whoever's controlling. Hello. There you go. I've done an overview there showing the actions. 6 of the 8 are on schedule as at 31st of March, and then you've got 10 key metrics that are either where 9 of them are either it's actually 7 are on target or above, and 3 that are below target at Q4. And the outcome measures on the right-hand side, there's only one of those, which I'll touch on in a moment. So all in all, that's a really, really good picture. And what I've done underneath that chart is list those areas that are of concern. I say of concern, but that since Q3, whilst it's shown as behind schedule for both of these actions, there's a lot of work that's gone on, and it continues to into this year. And that's working with healthcare partners to make it accessible for people to get health interventions in their communities. And also the single framework. That was delayed in year, but it will resume again in 2025. And it complements everything that you've just heard about the Tom and the work that's going on in the department. The priority metrics that are shown as below target are around, we've touched on this one, this is the one that's red. It's significantly below target where we want it to be. Meta is going to do me out of a job because she knows the numbers as well as I do. It is currently 55 days and 350 people on the waiting list as of today. But when we reported this, as I've written here, the figure was at 57 days. But the actual numbers on the waiting list have dropped dramatically. I'm sure I'll get questions on that. When I say I'm sure I'll get questions, I'm sure Meta will answer some questions on that in a moment. And then we've got the contacts starting at tier 3 or long-term service. That's slightly below target as well. The one I said I'd come back to, which is the outcome measures, is the percentage of adult social care users who feel they have control over their daily life. Very important in terms of independence, and this is the best result we've had since 2016. The figures are ranged between 77, 78, 74% over the previous years, and it's back up to 82%, which is incredible. I'd like to take questions, Chair. And as I say, just add something at the end.
Yeah, let me just move my reposition. Sorry. Ooh, sorry, everyone. Right, sorry. Anyone have any questions? Or is it quite straightforward? Councillor Self and then Councillor Weston.
Yes, so I'm looking at appendix
A2.
A2, yeah, and a lot of really good stuff, obviously greens, but I'm drawn to the reds, and I think you kind of explain the reasons for those, but I just want to know if maybe you might want to, if you want to elaborate on that at all, and if people are sort of waiting for an initial Care Act assessment, is there anything the council is doing to contact those people, just to keep in touch with them, to let them know what's going on?
Yes, so we have, which is also referenced by the CQC, we have what we call a waiting well framework.
which sets out practice guidance for how we keep in touch with people whilst they are waiting, including having contact with them. We have, this is sort of an internal language, but we have sort of what we call waiting well days or shutdown days, where practitioners focus inwardly, we review the waiting list, we reprioritise the waiting list. So everyone who's waiting will have been awarded a kind of priority ranking based on what we understand about their risks. And that's how we prioritise the order in which we allocate. The waiting well framework looks both at the amount of time that you've been waiting, but also at the priority rating, so that we don't risk a situation where somebody who's a lower rating never gets seen, because waiting for a long time in and of itself increases your risk. So we check in with people on our waiting well days, and continue to be in contact with people.
Sorry. Thank you, Councillor Self. Councillor Weston?
Thank you, Chair. No, it all, on the whole, looks very good. Obviously, we are drawn to the arrows. There is just one, and it's sort of cross-correlating with the first item on our agenda today. If you look at the metrics here, BPPM29A, reduce the percentage of contacts to adult social care starting Tier 3 services. And actually, one of the recommendations from our first report today was whether we need to move funding away from signposting to provide care. I would just be nervous that that statistic of people making contact and accessing Tier 3 care is dropping, and yet we're sort of being asked at the same time to reduce the support provided to signpost people to get Tier 3 care. So I just flag that as a potential issue, and maybe just leave that with Meta and Hugh when you're doing your response to the first item, that all is not well on that metric, and depending on how we respond to the first report, might make it worse. I'll leave that where it is.
Thank you, Councillor Weston. Councillor Blake and then Councillor White.
Thank you. Could you just remind me of the metric around work with health and care partners across the city to make it easier for people to access health interventions? So this is about contract extension. Just remind me of what that is. That one there.
That's an action, isn't it?
Yeah, but I just wondered what that relates to overall. Is it? Yeah. It's on the report. It's on the report. It's basically on page 2 of the report, and it's basically under item 3, and it says of the 8 business plan actions, 2 reported as behind schedule, and it says work with health and care partners across the city to make it easier for people to access health interventions. I just wanted to understand, like, if it relates to adult social care, what element of it relates to adult social care? Perhaps you can come back to me.
It's the advice and guidance commissioning. Isn't that what it is?
I'm going to have to come back to you. I think it could be, but to be fair, it's this is one of the business plan actions, and as it stands, it's sometimes there's a level of crossover between departments, but we'll get back.
All right, thank you.
Thank you. Thanks for the question, Councillor Blake. Councillor White.
Yeah, I was just going to follow on from what Mark said. I think going back to the report and what Alan said, there were some difficult conversations up front about the finite nature. So there was a discussion about, well, what could you reduce? So I think some of that comes out as of that. But I think you're absolutely right. It needs to be looked at in cost. And part of the officer response will be about cost-benefit analysis of some of those recommendations.
Councillor
Sorry, I might be making completely wrong links, but with the waiting lists, is there, with the kind of, just going back to the target operating model, is there a hope that changing the ratio between social workers and occupational therapists will improve those waiting lists at all? Is that part of it, part of the story?
Let me start. So, yes, in short. As Jamie explained earlier, one of the things that is very significant in the target operating is more resource and better processes right at the front. So when people first come to adult social care. And OTs are brilliant at prevention. That's one of the things that they bring to the table. They're really good at working with people on choice and control and on helping them to be self-sufficient or to reduce the need for care. So one of the things that we want to do with our front door activity is to support as many people as possible, as deeply as possible, if you know what I mean, with a deeper intervention on the front door, so that we can get people back on their feet and hopefully back off living their own lives and being independent. And OTs will make a very significant contribution. They do already now, but we want to have more of them to do exactly that. Yeah.
Thank you. Okay. Did you get a final point?
If I may,
Peter?
Chair, yeah, thank you. Yeah, it was just as I started, this was a report based on 24-25. We're now in 25-26. What we're going to be doing as part of the new performance framework is coming back through the chair to this committee to say which measures, which metrics do you want to look at, possibly even looking at how we set targets. So because we want to set them as Goldilocks targets rather than something that's too easy to achieve or something that's too difficult to achieve. It's getting the balance right. So that was it really. Thank you, Chair.
Thank you. Thank you for the report. Okay, final comment from Hugh on this report, and then we'll round up that section.
Yeah, I just checked in, and Meta's just texted me with the same information. Really, it's the reprocurement of what I think at the moment is well aware, isn't it? Which is the information system that provides information and advice prior maybe to people requiring social services or indeed health services, so community activity services in the voluntary and community sector, information about care providers, that kind of thing. And so there's an intention to reprocure that across the BNSSG system, I think. But we'll come back with more detail.
Yes, because that does need to be re-evaluated. Okay.
There's a practitioner there.
So, thank you, everybody. So, I'd like to just, for us to note, performance against the business plan relevant to the committee, including the issues raised, and measures to address performance issues to be implemented by relevant services. So I'd just like the committee to note the report. Thank you very much. So we're moving on to our final agenda item. I am trying to keep us on track.
I've got to go, I'm afraid. I have a WECA briefing on buses.
Oh, okay.
Yeah.
Oh, okay. Thank you. Thank you for your contribution and for your visitor. Thank you. Okay, so we're going to move on swiftly so that we can try and finish by 4:30. So this is agenda item 12, Adult Social Care Transformation Programme update. So this report is to provide us an update on the progress of the ASC Transformation Programme for quarter 2025. And there again, put my teeth in. There are no decisions to be taken on this report, which again is for noting. So I will ask Hugh to introduce and outline the report and any comments on the very end. Thank you very much.
I was going to make a comedy point there about fascinating reports being like buses. You don't get any for ages and then two come along at once. Well, I think that I think that landed quite well, don't you? Well, yeah. Thank you for that vote of confidence there. I'm not going to spend ages on this one because you've seen prior reports. Councillor Blake, I think I'd say more than anybody else has pushed for a better format for these reports. And I'm pleased to say that this is the last one of the old type. And for quarter one, which you'll get presently for this year, it will be a new report with more kind of graphic representations and ways of accessing information rather than trawling through trawling through a lot of text. So I think suffice to say that the transformation programme, I've got the key points to discuss bit open in front of me, but the transformation programme, now we're calling the transformation and improvement programme because we're binding in all of the elements of activity that are about kind of improvement of our day-to-day service activity. So things like the target operating model, work that you've seen today, work that we do in order to improve our cost effectiveness, etc. All of that will be bound in to the broader approach to transformation and improvement in the future. And I think the idea of that is that, the transformation and improvement of our activity is everyone's business, and we want everybody to feel like they are part of it and are involved. So there's a few of these key points to discuss. The second one was about the CQC inspection, which you know about. This report's out of date because it's Q4 and we have got the outcome of that, so I won't dwell on that. The first one notes that the transformation programme in itself delivered the savings that were set out in the MTFP for us in 2024-25, but we did start the year with a rolled over overspend, and so consequently, while some of the savings defined as transformational savings form about half of the overall financial challenge this year, that we have got the rolling overspend, which we're aiming to diminish as we go throughout the year. So when you get the next finance report, you can see detail on that, but long and short is that we aim to deliver something along the lines of around £14 million worth of efficiency this year. Sounds like a huge amount because it is, but it's out of an overall budget of over £200 million and a gross spend of even more than that. So the transformation programme also highlights the elements that in future, as I say, we're going to be concentrating on in regard to spend control, in that it looks at demand for services, it looks at the supply of services, it looks at the supply of services within the market, but also it looks at the services that we directly provide, and it looks at the services and the approach to meeting need that we have in partnership with our colleagues in the NHS, because there's quite a major chunk of our activity that's joint with the NHS. And as everybody will know, the NHS is in something of flux situation at the moment, but obviously we're supporting colleagues in the NHS who are having a very difficult time with that, but at the same time we're keeping our eye on the ball in regard to our improvement imperatives, especially when it comes to being cost effective. So that's really important. But as you'll see outlined in here, there's lots of stuff we're doing to ensure that the right number of people come through and receive adult social services. So if people can seek alternatives and support themselves for longer without recourse to adult social services, that's a positive thing. We're ensuring that the amount of service that's given to each person is the right amount, not too little, not too much. It's another Goldilocks type scenario. Too much care and support can actually be quite debilitating for people, as can too little. So we've got to get that right. And then the third bit, very importantly, we're looking to pay a fair price for the care that we buy. We spend the best part of 200 million a year on care, and we're looking to get a fair price for that from the market. So there's a range of things that are all underway, but I think probably I'd like to be able to assure you that the activity that we have underway for that is good, it's solid, it's being well reported on, and it's under significant scrutiny from our corporate colleagues in the council, but also, it's going to be increasingly open to scrutiny from this committee as well, and we welcome that. I think it's very important to note there are a couple of other underpinning enablers which we're really working on. You've heard about the target operating model today. That's a really important enabler for this. It won't necessarily deliver huge amounts of financial efficiency in its own right, but get that right and the rest will follow. It's that kind of thing. Digitalisation, major opportunities. One of the government's main 3 shifts from analogue to digital. We're convinced there's a lot of potential in in more digital ways of working, especially with the use of, and don't ask me questions on it because I'm not that clever on it. In fact, I'm not clever on it at all, but low-level AI solutions when it comes to efficient working processes. So we're looking at piloting a couple of those now, and a lot of work with our housing colleagues in order to develop a much greater capacity, especially of specialised supported housing for people with high-level needs who need specific housing and quite capable services in order that they can be catered for and supported in their own communities, near their families, and where they feel at home. So lots going on, but I think probably the abiding message I'd like to give is that we are on top of it all more than ever. So this is year 4 of what is a 5 to 7 year programme. We really are on top of our transformational work, and that, as I say, we will be coming back to you with more detail and different ways of looking at it in upcoming months.
Thank you very much, Hugh. Any final questions for the afternoon? Okay, so thank you very much. I think then we've had quite a good session today. Lots of nice, healthy questions. So, a final statement. So the recommendations from our officers is that the committee, 1, notes the transformation update report provided, and 2, notes that baseline funding is due to be approved through the corporate transformation reserve funding request being presented to strategy and resources, which is done already. So this is retrospective, May 25. The programme is currently utilising the underspend for 24-25 to continue the programme and projects whilst waiting for the new mandate approval. So I would just like the committee to note the recommendations. And we've reached the end of the meeting. So thank you everybody for attending today. And just to note that we will not have any committee meetings over the summer, and we will resume on the 1st of September. So thank you all very much. Thanks.
Summer recess.
Summer recess.